Please be upstanding and at attention for the Kenya National Anthem and the East African Community Anthem.
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Thank you, ladies and gentlemen. You may kindly take your seats. Our gracious host, the Cabinet Secretary, Minister of Health from the Republic of Kenya, Madam Dr. Deborah Mulongo Baraza, our visiting ministers from the Union of Comoros, Dr. Nasuha Hossein Salim, representation from the various countries present, and the ministers, the representation of the ministers. We have Dr. Amar Morenda from Ethiopia. We have Dr. Sarwan Singh Pramusur, who's from Mauritius. We have Professor Cloud Muvunyi, who's from Rwanda. And we also have Fadil Abdallah from Tanzania. And ladies and gentlemen, just recognize as well the countries present from the Republic of Djibouti, from the state of Eritrea. We also have Federal Democratic Republic of Ethiopia, Republic of Madagascar, Republic of Mauritius, as I mentioned. We also have the Federal Republic of Somalia, Republic of Sudan, Republic of South Sudan, United Republic of Tanzania, and Republic of Uganda. Kenyans, please, can we please welcome our guests and visitors as well to Mombasa. I pray that over the next 3 days, you'll be able to sample the great hospitality in this county as well and the region. So thank you for being here. I also want to recognize the Principal Secretary, Madam Mary Muthoni Muriuki, who's the PS Public Health and Professional Standards. I also want to recognize the Deputy Director, Africa CDC, Dr. Emmanuel Nzai, Chair of the Vision 2030, Dr. Dele Davis, who's the Chancellor, University of Nebraska, the WHO Country Director, FAO. We also have the BioVax Chairman as well, Mr. Honorable Mishra. Ladies and gentlemen, to our sponsors and partners, good morning to you all. Good morning. As you can tell, I'm really making sure that I can recognize you. Over the next 3 days, we'll be hearing from most of you, if not all of you, on really how we can strengthen the health and prosperity, one community at a time, being our East Africa Region Global Health Security Summit for 2025, taking place right here at Pride in Mombasa. My name is Laban Cliff Ontario. I'll be your facilitator over the next 3-day period. This would not have been possible without the able support that we're getting from our sponsors and partners. But really quick, allow me to recognize the Safaricom team, represented, of course, here by their leadership. We also have the International Livestock Research Institute, that's ILRI. We also have the East Central and Southern Africa Health Community, that's EARGHSS, who are represented, and of course, AMREF and BioVax. Let's give a round of applause to our sponsors, as I mentioned. We also have various partners who are on my left, but really quick, of course, in view of their appreciation. The Ministry of Health Kenya, as I mentioned, the Jumuiya County Pwani, Terumo, that's Blood and Cell Technologies. We have Health Sciences. We have Revital. We have the Kenya Healthcare Federation. I see the CEO here as well. We have AMREF Group as represented. Community Health Promotion Fund. We have KCB. We also have the Africa Health Business. We have the Kenya Vision 2030, the Global Center for Health Security, and of course, many partners who are here. Let's give a round of applause to our partners. So ladies and gentlemen, I hope you're all excited. Thank you very much. For those who are watching us online as well, karibuni sana to the summit. We have an exciting program to look forward to wherever you're tuned from in Kenya and around the world. Welcome as we talk matters health and how do we ensure that we can strengthen the systems in our healthcare systems in Kenya and of course in the region. Without further ado, ladies and gentlemen, allow us to just kickstart the program. Let me call on stage our convener, a good friend, Dr. Emmanuel Nzai, who's the CEO, Jumuiya Economic Development Secretariat, and the chairman, Kenya Vision 2030 Board, to take it up from here. Let's appreciate him, please.
Thank you. Good morning, everyone. Good morning, delegate. That's not enough. Good morning. Habari zenu. We wave at the top of our hands like that. That's why we do it out in Mombasa. Can we wave, all of us, please? Very good, very good. So my name is Emmanuel Nzai. I'm the CEO of Jumuiya Counties of Pwani. Jumuiya Counties of Pwani is the regional economic bloc which brings together the 6 coastal counties. These 6 coastal counties, we call them the first counties because they start with 001 to 006, and they also have the ocean. So it is the trade and logistics cluster, one people who are here who have a very rich history. So on behalf of Jumuiya Counties of Pwani, represented here by our Deputy Governor of Kilifi, who is also representing the chair, Karibuni, which is welcome. Our chief guest, the Cabinet Secretary, thank you so much for being here. The World Health Organization, which is here, the PS, who is here, our Africa CDC Eastern Region Director, Dr. Mazianga, and all the member states who are here. Most of you who have come from many different places in this world, not only in Africa, but across the world who are here. Our technical partner who is with us here, the University of Nebraska, the Africa Health Business, which is representing the private sector, the technical bit, which is represented by universities which are here, Amref International Universities, and most of you who are here. Karibuni sana, and we're really, really happy for you to be here. I wear also the other hat. I'm the chairman of the Kenya Vision 2030, the co-convener of this conversation, and you may wonder why. So this is really, really important. My job here right now is to simply give some small context of why we thought it was important to bring in this summit. Cabinet Secretary and member states of Africa CDC Eastern Africa, this journey started in a very simple way, very, very personal. As a citizen, I'm out in the US. I have my friend in Nebraska. I go to look for college for my daughter at the University of Nebraska. She just graduated in the pandemic times, and she was looking for a public health master's program. So I was told there's a university in Nebraska, and there's people out there. So I go to University of Nebraska. I get to meet who is now has become my friend, Vicky. Where's Vicky? Please stand up where you are. You can wave. You can wave to Vicky. So most of you who are here have come to know Vicky. Vicky is from Uganda, but like I say, she is now Nebraskan. And in Nebraska, they say there is more cows than people. So fortunately, she is there to represent Uganda and represent Africa. There is other great Africans that will hear, who are here, which we'll talk about. But in that journey, and in walking through to simply learn about the place, apart from the many, many things that I saw this sign and a nice brand. University of Nebraska Medical School. I had kind of seen the history of it, but I didn't know there was a global center for health security. So I see that plaque, and in my training as a development economist, I'm looking for brands to bring into my region for us to be able to partner and bring about economic development. So flashes get in, how do I partner with these people? So I asked the basic question, you're global. In Kenya, we host the United Nations, we host Africa CDC Eastern. Are you in Kenya? That's how that conversation began. And we said, well, if you are not in Kenya, then you are not in global. If you are not in Africa, you are not in global. We need to bring this conversation. So what have you been doing? The story that came from there was very, very interesting with our now lead. We call him Captain because he kind of maneuvered this plane for us to land us with this program. Dr. James Lola, who is a director there. And he started saying a story about how they've been able to fight, how they were able to fight the pandemic, lessons learned from there, but how they've been able to carry that conversation in communities, in different states across the United States, for them to simply educate and prepare them for pandemic. So I asked another question, so far, how many states do you have which are more prepared for pandemic? They named us so, but they also assured me that it's work in progress and it's a continuous process. So through that, the ask was, look, can we do this in Africa? With the lessons learned, your university, in Kenya and especially the Vision 2030, we have a model which is called the triple helix, which will bring the public, represented by government, we bring in the private sector, we bring in the university, in a university system, the thought leadership. Can we do this? And initially the conversation then ran into me calling my good friend Dr. Benjamin Sofa of the great institution Cambridge, who was leading much of the pandemic lab work testing, and we worked very, very closely in this region at Kilifi. So Kilifi has a Cambridge Institute, which is great, and they have Pwani University, they're doing a medical school. We have Revital. Most of you will hear about Revital manufacturing, which is in Kilifi. Out of that quick conversations, we all qualified that we needed to go to Africa CDC Eastern for us to have this conversation and probably be able to convene this. And for sure, when we reached Africa CDC, Eastern Africa, fortunately hosted in Nairobi, it was very well received. And from there, we went through the protocols. The government of Kenya took it, now with the Vision 2030, with the ministry, and at this point, I want to really recognize our principal secretary, Mary Muthoni, who led us at the technical bit to work with us in this very difficult mission, but who said we need to do it. One, there is no postponement. We have to do it. We have, as long as we have the key partners, even if we have 3, 4, 5 people who come gather together and reflect, let's just do it. So ladies and gentlemen, that is the journey that took us into this. Through this journey, we went to Uganda, we went to Rwanda, we went to Ethiopia, we went to Tanzania to have dialogues and sit down to simply reflect and mark a sound in this conversation. We had a conversation here in Kenya, and through that we put this program forward, which is very, very inclusive in many, many ways for us to be able to have a conversation with very, very clear outcomes that we can all look forward to and probably be charged for us to be able to run with them from here. So to the member states who are here, who are led now by our host, Cabinet Secretary, we're very, very thankful for this. That we could be able to do this, and we all really, really appreciate much of your effort, and we welcome you here. And so with this very, very brief, I want to take this time to welcome my sister, Flora Chibule. She is the Deputy Governor of Kilifi County, one of our lead counties, and it so happens that's my county. I live very, very close by here. But she's representing the governor, and who is also the chair of this regional economic bloc. DG, karibu.
Bonjour. I know we have a few of us who maybe don't know English. Good morning. And habari asubuhi. Let me ride on the protocols already established, CS and all who are here. My name's Flora Chibule, the Deputy Governor of Kilifi County. Kilifi is one of the 6 coastal blocks, Jumuiya za County, and I stand in for my governor, His Excellency Gideon Maitha Mng'aro, who is the chair of the 6 block of Jumuiya za County, from 001 to 006, that is Mombasa, Kwale, Kilifi, Tana River, Taita Taveta, and Lamu County. I'm reading his speech, thank you. It is with great honor and enthusiasm that I stand before you today representing His Excellency Gideon Maitha Mng'aro, the Governor of Kilifi County, to this remarkable Global Health Summit. The Governor, a passionate advocate for improving health outcomes, deeply regrets not being able to attend in person, but fully committed to advancing the cause of health and wellness within our communities. As we gather in this beautiful East African region, a region of promise, unity, and shared challenges, we are reminded that our collective health and well-being are the foundations upon which we must build prosperous, thriving nation. Today, I would like to share the story of Kilifi County's health transformation driven by His Excellency Mng'aro, unwavering belief that every individual deserves access to quality, equitable, and affordable health care. We understand that true development begins with good health. We are committed to ensuring that health is accessible to all, regardless of their background, their social standing, or geographical locations. Over the last 2 years, ladies and gentlemen, Kilifi has undergone a remarkable transformation in its health sector. The progress we have made is a testament in the dedication of our leadership, the hard work of our medical professionals, and the invaluable partnerships we have cultivated with both the national and the international stakeholders. This journey has been characterized by major investment in infrastructure, healthcare, technology, workforce development, and the strategic deployment of resources to address the health needs of our people. A critical component, therefore, of this transformation has been the modernization of our health facilities. The physical environment of our hospitals has been improved, making them more welcoming, accessible, and patient-centered. But it is not just the surroundings that have changed. It is the way we deliver care. Kilifi has witnessed the donation and procurement of state-of-the-art medical equipment and technology. This has greatly enhanced the ability of our health providers to offer accurate diagnostics, effective treatments, and life-saving interventions. We are also incredibly proud of our of our emergency medical services. We have 1535. We have significantly upgraded our fleet of ambulances, ensuring that they are equipped with the latest life-saving technology. These ambulances are provided free of charge to all our residents, ensuring that no one is left behind. Emergency care is needed to all of us. Our pandemic teams, composed of highly skilled and experienced professionals, are dedicated to ensuring timely and efficient responses even in the most challenging conditions. Of course, no healthcare system can operate in isolation. In Kilifi and in the coastal block, we believe that the future of health is rooted in partnership. partnership that brings together government, private sector, development partners, and the community. We are not only proud of the work we have done, we are equally excited about the partnership we are building. We have already forged strong relationships with stakeholders across the health sector or ecosystem and continue to welcome new collaborators to help us enhance the health sector. In this Jumuiya block, we only have one level 5 hospital, which is in Mombasa. And the rest of the other counties, we have level 4, level 3 going downwards. These partnerships are vital for expanding our resources, scaling up innovations, and ensuring that our efforts are sustainable and impactful. However, despite these positive developments, we are not blind to the challenges we continue to face. Challenges that are global in nature, the emergencies of public health threats like COVID-19, Mpox, has underscored the need for resilient health systems. These crises have highlighted gaps and areas for improvement. In my county, we have responded proactively, ensuring that we are better prepared for future health emergencies. The pandemic, in particular, was a reminder of the importance of strengthening our public health systems, and we are ready to prevent, detect, and respond to such threats swiftly. In response to this, therefore, we have implemented a series of critical measures to enhance our health infrastructure and workforce, which I would like to highlight in just 2 minutes. Aligning with national health policies, Kilifi has worked closely with the national government to foster universal health coverage through the Facility Improved Funding Program. We have been improving our health systems financing since the year 2019. We have also identified indigent populations to ensure that we are covered by NHIF, and we are working towards transitioning that to the Social Health Insurance Fund, SHIF. Further, we began the preparation of the Community Health Service Bill in the year 2022, which will help us better coordinate and enumerate our community health promoters who play an essential role in reaching underserved communities across all counties in Kenya. Strengthening laboratory systems. One of our key priorities has been to modernize our laboratory systems. We have placed cut-edge diagnostic equipment of our laboratories and ensuring that we meet global standards for quality and accuracy in detecting pathogens more efficiently and support rapid response to emerging health threats. We are also enhancing our laboratory network to facilitate quicker sample transportation and faster relay of results. 3, enhancing surveillance systems. The ability to detect outbreaks of infectious diseases quickly is crucial to mitigate their spread. To that end, we have built a robust surveillance system that allows us to monitor, detect, and respond to health threats in real time. Our surveillance systems are now more agile and integrated, enabling faster and decision-making and more coordinated. For our workforce development, we are committed to build a skilled workforce capable of responding to the public health challenges of the future. We have focused on hiring and training health workers, especially in areas of outbreak prevention, detection and response. Our medical professionals are equipped with the knowledge and skills necessary to act swiftly during crisis. Number 5, public health emergency response. With the support of WHO, World Health Organization, we are establishing a public health response center that will be integrated with our existing county emergency operations center, courtesy of Safaricom, who have helped us in that. This center will coordinate our response effort, ensure rapid mobilization of resources, and provide a hub for managing public health emergencies effectively. 6 is building strong partnerships. We recognize that healthcare challenges are multifaceted and require the expertise and collaboration of diverse sectors. In Kilifi, ladies and gentlemen, strong partnership with both government and non-governmental agencies, and we continue to welcome new partners on board to help us expand and enhance our health programs across the block. 7, investment in health infrastructure and technologies. We are also making substantial investment in infrastructure and technologies. This includes implementation of electronic medical records to streamline patient care, expanding access to telemedicine to reach rural populations, and incorporate other cutting-edge technologies that improve our healthcare delivery. Last but not least, we are looking at health product security to ensure that essential health products are always available. We have established a unit that enhances commodity security. We have established, this unit helps us manage forecasting, quantification, and budgeting to ensure we have adequate stock to essential medical supplies. Additionally, we have 2 trucks to improve the distribution of health products to hard-to-reach areas in our county. Ladies and gentlemen, in conclusion, I would like to emphasize that health is the foundation of development. A healthy population is more productive, more resilient, more capable of driving positive change. As we continue to build stronger health systems, let us remember that our work here is not just about tackling today's challenges, but also about creating a healthier, more sustainable future for generations to come. Before I leave the stage, I have one ask. University of Nebraska, you have the Global Center for Health Security. In Kenya, in Kilifi, in Africa, we're asking for a center, Africa Center for Global Health Security. Kilifi, standing at an acreage of 13 kilometers squared, we have the space, and we believe that we are going to take this forward. So thank you for your time, your attention, your dedication to the cause of global health. Let us continue to work together to ensure that health is right, not a privilege. It should be a right for every person across East Africa region and beyond. God bless us, God bless you all, and may we continue to make strides towards a healthier tomorrow. Asante sana. Thank you.
Another resounding applause, please, to Madam Flora Bessa Chibule. Great remarks there, of course, representing the Coastal Blockers, Jumuiya Counties of Pwani. And Madam, I think this is a reminiscence of the Kilifi International Investment Conference, showing the level of interest. And of course, today we're discussing matters healthcare and seeing how we can sustain that conversation. Ladies and gentlemen, the next speaker is a true testament of the tripartite conversation between government, academia, and private sector, and a true champion of that. As Dr. Nzai mentioned, this is a world champion from the University of Nebraska as well, and looking at the involvement of the government. First, before I invite Dr. James Lola, allow me to ask the team. I think they've painted Mombasa red. If you know you're here from the Global Center for Health Security, please stand. Let's give them a resounding applause and welcome them to Kenya, actually. Thank you so much. Oh yeah, thank you so much for being here. Thank you very much. And also want to now officially welcome the Associate Director for International Programs and Innovation from the Global Center for Health Security at the University of Nebraska Medical Center, Dr. James Lola, who will later invite Dr. Della Davis, who is the Chancellor. Karibu sana, sir.
Thank you. Thank you very much. Wow. This is an incredible sight to see. Welcome to everyone, all protocols duly observed. This has been a long process, as Chairman Zai has mentioned. This started almost a year and a half ago, discussing the idea of creating a summit, and it's been a roller coaster journey. But as I mentioned in our media kickoff, from the very beginning, I had a sense that this was destiny at work, and that there were forces that were going to make sure that this summit happened, and that the region was able to gather together to discuss lessons learned, and more importantly, how to work in the future to prevent such catastrophic consequences from health emergencies from happening again. And it has really been an honor to be a part of that process, and to have the opportunity to just ride on the bus as it's moved along. I think from very early on it was clear that I had very little opportunity to steer the bus and to make things happen. It was happening on its own, and that's a great feeling, to be a part of something that really is bigger than you, bigger than our institution. So our team is here, and we've been a part of this from the beginning because we believe very strongly in that concept of global health security. We are a global center because these threats, pandemic threats, emerging infectious disease threats, they affect all of us globally, and none of us is safe until all of us are safe. And hopefully we've learned the lesson now that events that happen on the African continent, events that happen in Asia, events that happen in North America can affect everyone in the globe. And we see that currently, whereas recent outbreaks of viral hemorrhagic fever, not far from here, Mpox, H5N1 avian influenza, currently occurring in the US and affecting millions of dairy cows in ways that we haven't seen before. All of these have huge implications for global health, and obviously we have the lessons from the COVID pandemic that still should be fresh in our minds. So really important that we're gathered here for these 3 days to discuss what we need to do to prevent these events from happening again. From very early on in our conversations with partners and stakeholders here in the East Africa region, it's been clear that a few lessons resonated from the pandemic experience, and again from experience of other health emergencies. And one is that, like politics, all pandemics are local, right? All health emergencies really are having impact at the local level, and they can scale and they can affect regions, nations, continents, but in reality it's what happens at the local level that determines the outcome and determines the impact. And so refocusing our efforts at the local and community level is critically important if we're going to create systems that can actually prevent what happened in 2020. A second theme that I think was really prominent early on, and really the testament is in Chairman Zai's interest and really his idea of creating a summit, is that pandemics and health emergencies do not only affect the health sector and the health of population. It's not just lives, but livelihoods that are affected by pandemics and health emergencies. And the impact in the private sector, the impact across social organizations and communities in 2020 and 2021 and continues today is huge. And so these entities within our society and within our communities that are so affected have a real stake, not only in the outcomes, but should have a stake in the work that's done to prepare and respond to these health emergencies. And it's, I think, a large portion of our society that often does not get a seat at the table in discussions around health security like we're having here, and doesn't have the opportunity to offer the wealth of resources that they can bring to bear. And so hopefully that is something that we can explore in these 3 days. It takes a whole of community response to be able to prepare for and mitigate the impact of these health emergencies and future pandemics. The third principle, I think, that is one that, again, resonated in our discussions is the idea of sustainability and inherent capability within the region. I think for many it became clear during the pandemic that no outside forces are going to come in to help and to respond, that in these health emergencies, unfortunately, I think the pandemic demonstrated that we're all on our own in some instances. And we need to strive to make a better global community that can respond in a coordinated way, but that is more of an aspiration than a reality at this point. So if regions are going to be able to mount and sustain their own response, that needs to start in preparedness. And the East Africa region, I think, is uniquely positioned to be able to develop a model and show the rest of the world how to do that. And that's been, I think, a message that has, again, resonated with a lot of the partners that we've met with. Lastly, I think it's obvious, hopefully, to all of you that COVID is not going to be the last pandemic. COVID is almost certainly not going to be the last pandemic in our lifetimes. The pace and rate of emerging infectious diseases continues to increase. And unfortunately, we don't have to look very far, again, to some of the examples I mentioned, to where these threats are out there and imminent. And so there should be, hopefully, a sense of urgency among all of us to get to work and to make this happen. So again, welcome and thank you. It is a beautiful sight to see everybody here, the culmination of all of this effort. But in a large way, this is not the culmination of the work that's happened over the last year. We hope that it's the starting point of efforts regionally to develop new systems and new approaches, innovative approaches for how we can build whole of community preparedness and response systems that are
health and graduate studies, but we also have allied health programs that involve 15 different health professions. We also have 3 institutes that focus on 3 specific areas: cancer, child health, and developmental disabilities. And we have almost 5,000 students. All of them focus on healthcare. And so this is our focus, is purely healthcare. We don't do anything else. And we've continued to grow every single year over the last several years. We are global, and so our students come from all over the world, 83 countries, and our programs are ranked among the very best in the country. So in terms of training, we're considered one of the top 10 for training, and in terms of research, we're top 50, and so forth. But really, the key thing that I want to point out is that we are really leading in terms of how we transform healthcare education, and we're looking at not training the traditional way. You know, we're used to what we call the sage on the stage, where somebody gets in front of you and gives a lecture. A lot of our training is based more on competency, hands-on training, where we want to make sure that every trainee is competent before they ever touch a patient. And we do that through simulations, We do it through augmented and virtual reality. And as AI grows, we're going to introduce and infuse more and more AI to train our students so that they're very, very competent before they ever touch a patient. So we also have a very strong cancer center. It's one of the leading cancer centers in the country, one of the few that are designated by the National Institutes of Health as an NIH-designated cancer center. We have a Center for Drug Discovery, and I say this because I know there's a lot of work going on, and I was talking to colleagues earlier and about the possibilities of opening a vaccine center here and developing drugs. This is something that we obviously are quite involved in. So why are we even here talking about this? So in 2014, when the Ebola outbreak occurred, we were one of only 3 sites in all of the United States that were able to take care of patients with Ebola. And that's because we had a biocontainment center that we'd been using for getting ready for the 10 years before that. And that biocontainment center, we had not just a space, but we actually had a team of healthcare providers who had been drilling for 10 years for the possibility of Ebola before Ebola ever showed up. And so when Ebola showed up, we were ready. We were ready because we had the facilities, and we were ready because we had the trained people. And that is the message, if anything, I want to leave with you today is preparation, preparation, preparation. Preparation will not get you 100% of the way because there's always going to be something, right, that you have not figured out. But it will certainly make you much better ready to deal with any kind of outbreaks that occur. And that's why this conference and this summit is so important, because it's really talking about how do we prepare, how do we get ready, what are the things we need to do, what are the lessons learned from other places that we can use to bring back so that we're ready for that outbreak. As a result of taking care of the patients with Ebola, we were then seen by the Centers for Disease Control, by the Assistant Secretary for Preparedness and Response, Health and Human Services, Department of Defense, as a trusted partner for taking care of patients with infectious diseases. We soon received the designation as the National Center for Emerging Infectious Diseases. We're designated as the only site now in the country that has a fully federally funded quarantine unit for patients who've been exposed to deadly diseases. So these are not those who are already sick. Those are those who are exposed, where we can observe them safely and make sure that nobody is in trouble. And with COVID, we were the very first site in all of the United States that received patients who had COVID. In fact, Colonel Lawler and his team actually went on the ship and helped bring those patients. We were the first in the country, again, just showing you the trusted nature that we have. So when there's any pandemic now in the United States, we are certainly a place that's turned to, and our global health security plays a leading role there. And so part of what we want to do is really bring this expertise that we've now shared with literally thousands of people across the United States and around the world. And we've been participating in all kinds of responses, including as recently as helping with the significant mpox outbreak that you heard about earlier. We had a patient who was recently diagnosed with Lassa fever in the United States, and our team was intimately involved in all of that. So, the Global Center for Health Security are the world's experts in proactive research and active response. Our team provides responsiveness for high-consequence infectious diseases, pandemics, and other health emergencies. And when we think about responsiveness, there are different aspects. When you think about how you deal with a pandemic, there's preparedness, right? There's response, and then there's recovery. And all of those 3 phases are important in terms of the ability of any community to take care of highly consequential infectious diseases. And these are the domains of what we do, or the Global Center does. The first is the clinical that I talked about, which is caring for patients with highly infectious diseases. Education and training, which is probably the largest part of the work that's done by the Global Center. The research, which includes things like drug discovery and public health. But really, It's innovation and public partnerships that are really, really important to us. We have partners now from 33 countries around the globe, working together, sharing best practices, looking for ways to keep all those countries safe. Because as I like to say, infectious diseases do not respond, they don't respect passports, they don't respect visas. You know, they go on planes, they go on trains, they go on automobiles without permission. So we have to be ready for them. So we have a number of partnerships across the United States, and here's some of them. We partner with the EARGHSS, we partner with the National Disaster Medical Systems, NETEC, which I mentioned, National Emergency Special Pathogen Training and Education Center is now located at UNMC. And you know, we also have this regional disaster response ecosystem, which is really a way of sharing information across several states so that when there's any kind of a disaster, all those states can work together. So it's not just in isolation. We can share resources, we can share information, we can share knowledge. So we've trained thousands of people, or many sessions, lots of research funding, and as I said, we partner with several different countries. And finally, I just want to introduce our team. And some of them are here, at least a couple of them are here. You met Dr. Lola earlier, and actually the director, Dr. John Lowe, he's standing at the back there. He's got the handsome haircut at the back, waving. Can you wave there, John? Okay, so he's the director of our global center. We have, you know, directors that cover different areas. But really, we're here to listen. We're here to partner. We're not seeing ourselves as experts. We're seeing ourselves as collaborators. And as Dr. Lola said, we don't presume that we have all the answers. We certainly know what we've done. We know things that work well. We think about things that are practical. But we also know, and I've met several of you who have done an incredible amount of work right here in Africa. And we want to exchange ideas. We want to think through how we can move to the next level of preparedness and make not just this region, but all of Africa safe from one of the biggest threats to humanity, which is infectious diseases. So I want to thank you for your time. I can be reached. My information is right there. If anybody is interested in learning more about anything that I've shared today. But mostly I just want to say thank you, welcome to this summit. And again, we're very proud to be partners with all of you on this journey. Thank you.
Thank you, Dele. Appreciate it. A resounding round of applause to this African child in the United States doing amazing work. Thank you also to the team that's, of course, accompanying the Chancellor and the leadership for University of Nebraska. Ladies and gentlemen, indulge me on this one. We will have the next speaker come up representing the Union of Comoros. But before I invite him, allow me to recognize the East Africa Medical Vitals, and of course Revital as well. Let's give them a round of applause. They are our sponsors too. And the Republic of Botswana, we have representation. If you can just wave, if you're from Botswana, please just wave as well. Thank you so much for being here. Without further ado, the next speaker will be speaking to us in French, but we'll have translation and a summary of that speech offered by Dr. Abdurrahmane Diallo, who's the Kenya WHO representative. So please allow me to welcome Dr. Nasuha Hossein Salim, who's the Minister of Health, Solidarity, Social Protection, and Gender from the Union of Comoros, to come up on stage.
Bonjour, good morning, good morning. Je vais parler en français. Hein? Alors, mesdames et messieurs les ministres, distingués invités, chers collègues, tout protocole observé. C'est avec un grand honneur et une profonde responsabilité que je me tiens devant vous aujourd'hui à l'ouverture de ce premier sommet régional sur la sécurité sanitaire mondiale en Afrique de l'Est. Ce rassemblement mémorial témoigne de notre engagement collectif à forger un avenir plus sain et plus résilient pour notre région et pour notre continent. Je me tiens devant vous avec un double rôle. Je suis le ministre de la Santé de l'Union des Comores, mais j'assume également l'honneur de remplacer la présidence du comité ministériel régional du piloté pour l'Afrique de l'Est et de CDC Afrique. Les fonctions de responsabilité comprennent, entre autres, la fourniture d'orientation stratégique au secrétariat du Centre de coordination régionale et d'Afrique SUDC sur les initiatives et les interventions de santé publique conformément aux priorités stratégiques de CDC Afrique. Alors que nous nous sommes réunis ici, nous nous souvenons du rôle essentiel que jouent les partenaires stratégiques dans le domaine de la sécurité sanitaire mondiale. Nos objectifs au cours de ce sommet sont clairs. C'est de favoriser la collaboration entre le secteur public et privé, élaborer des plans d'action pour renforcer durablement le système de santé et la préparation aux situations d'urgence, de partager les pratiques exemplaires, d'étudier des cas réussis qui guideront nos efforts futurs en matière de sécurité sanitaire. Le thème de notre sommet sont à la fois opportuns et impératifs. Donc, il y aura une préparation à la réponse à la pandémie. Nous avons tiré les leçons inestimables de la pandémie du Covid-19 et il est de notre devoir d'utiliser ces informations pour éclairer nos stratégies en cas de future crise sanitaire. Le bioterrorisme et la biosécurité, les risques posés par les menaces biologiques sont réels et évolutifs. Nous devons être vigilants et proactifs pour faire face à ces dangers afin de protéger nos populations. Le renforcement des systèmes de santé, c'est la mise en place de systèmes de santé résilients capables de résister aux crises est essentiel pour le bien-être de nos communautés. Pour ce qui est de l'équité en santé mondiale, c'est d'assurer un accès équitable aux ressources en santé n'est pas seulement un objectif, c'est un impératif moral. Chaque individu, quel que soit son parcours, mérite d'avoir la chance de mener une vie saine. Pour ce qui est de la technologie de la santé innovante, le rôle de l'intelligence artificielle, du big data et de la télémédecine dans la sécurité sanitaire ne peut être surestimé. Nous devons explorer et adopter ces innovations pour améliorer nos capacités. Pour ce qui est des infrastructures essentielles pour la santé, le renforcement de la capacité de fabrication et de chaînes d'approvisionnement régionales est fondamental pour notre capacité à répondre efficacement aux urgences sanitaires. Aux Comores, l'état de santé reste un défi de taille avec une lutte continue contre les maladies telles que le choléra, la diarrhée aqueuse aiguë. Notre système de santé est soumis à une pression immense. Les catastrophes naturelles en cours, comme les récents cyclones, exacerbent encore la situation, d'où l'importance cruciale pour nous de donner la priorité à la sécurité sanitaire mondiale. Le gouvernement de Comores s'est engagé à relever ces défis à travers diverses initiatives. Nous avons élaboré des plans pour intensifier notre réponse au choléra et nous travaillons activement à améliorer nos systèmes de surveillance et de riposte. Nous avons renforcé nos systèmes de santé communautaire et nous sommes en train de renforcer la résilience du personnel en santé dans les 3 îles de l'Union des Comores. Aujourd'hui, alors que nous nous laissons ensemble dans cette aventure, laissons-nous guider par une vision commune d'un avenir plus sûr et plus sain pour nous tous. Engageons-nous à travailler pour transformer nos discussions en actions concrètes. Et nous n'oublions pas nos efforts aussi auront un impact durable sur la vie de millions de personnes en Afrique de l'Est et au-delà. Nous vous remercions de votre dévouement, de votre collaboration, de votre engagement indéfectible à l'égard de la sécurité sanitaire mondiale. Je vous souhaite à tous un sommet productif et inspirant. Je vous remercie. Thank you very much.
Ladies and gentlemen, I'm not the Minister of the Comoros, definitely not. He is. I've been given a task, and I've discovered that I can do some other stuff, translation. So I'm going to just summarize very quickly His Excellency's comments. He's the Minister of Health of the Comoros. It's a pleasure and an honor for him to be here, and he thinks that everyone coming together is a sign of collective commitment to a better future. And he said that he's wearing two hats, like me too, a translator and something else. So he's wearing two hats. He's the Minister of Health of the Comoros, but at the same time, he is standing in for the chair of the Africa CDC, Eastern Africa Regional Ministerial Steering Committee, and as such, he provides strategic guidance to the Africa CDC Regional Coordinating Center. So he talked about the critical role of strategic partnership in global health security, and thinks that the objectives of this summit are really timely, particularly talking about fostering collaboration between public and private sector, the importance of health system strengthening, so building resilient health systems, obviously emergency preparedness and response, but it's also an opportunity, he said, to review and discuss best practices. And yes, the themes also, he found them really interesting and motivated and guided their presence here, their participation to this summit, pandemic preparedness and response, bioterrorism and biosecurity, global health equity. He talked about ensuring equitable access to health services and resources, and also stretch the relevance of innovative health technology, particularly the role of artificial intelligence, telemedicine, among others, and touched on the need for critical infrastructure for health, regional manufacturing, of course, and supply chain. And he said in the Comoros that they also face numerous challenges, including cholera and acute watery diarrhea. But the government of Comoros is committed to properly addressing those challenges, and mentioned that also that the recent cyclone exacerbated the challenges that he mentioned, but again reiterated the government's commitment to strongly addressing those. So called for all of us to come together and develop lasting, impactful efforts, and thanked the organizers for inviting him, and thanked all of us for our commitment to make the world safer. So that's the summary of his speech.
Right, ladies and gentlemen, please give a resounding applause to Dr. Abdurrahmani Diallo, who's the WHO Kenya representative. Ladies and gentlemen, as we mentioned, we have great representation as well from the private sector. We've had from academia, and now moving to the private sector, we're honored and glad to have the Chief Enterprise Business Officer at Safaricom, Madam Cynthia Kropak, who will be speaking on behalf of the private sector and, of course, in our capacity at Safaricom. Let's give her a round of applause, please. She comes on stage.
Allow me this morning to write on the protocols already observed and say good morning, everyone. How are you all doing? Really good group of people, very excited to be here this morning. As indicated, my name is Cynthia Kropak. I'm here representing Safaricom as not only part of the private sector, but a big partner and participant in public-private partnerships to advance not only health, but economic development in this country. So, first of all, welcome to all the visitors to this beautiful country. Thank you, Emmanuel Nzai and Vision 2030 for putting this program together on this very important topic on advancing healthcare security for the region. As most of us know, being here from Africa, the future is not something we're waiting for, it's happening right in front of us. It's something we're actively building and accelerating. Here in Kenya, no different from the rest of Africa, we have a very young population. More than 75% of this continent is below the age of 35. More than 60% is below the age of 25, the age group I belong to, right? But with the population at 55 million, where the majority are young, our mobile coverage stands at over 97% of the population with connectivity or 5G. And digital adoption is a reality in how that is transforming our lives and how we work. Yet resilience, even as I stand here as a member of the technology community, technology and innovation alone is not the answer. It's about how we ensure that no one is left behind, that health, security, and prosperity are within reach of every household. And this conference on global healthcare security, focusing on preparedness and effectively addressing the next crisis if and when it comes, is how we get ready, how we become resilient. And we stand at a defining moment. Here in Kenya, as the rest of Africa, our security landscape is shifting. Traditional global funding sources, which have been the backbone of our healthcare system in Africa, are shrinking. Donor priorities are shifting. Pandemics are becoming more frequent and more severe. Yet our challenges are still quite urgent. Cost of care is rising. Affordability remains an issue. Malnutrition and food insecurity, driven by conflict, climate change, and economic instability, resulting in high mortality rates. The burden of infectious and the alarming trend of non-communicable disease growth continues to impact not just our well-being, but our economies, our security, and our future. But this is not a cause for despair, ladies and gentlemen. It's a call to action, because this is our opportunity to take control of our own destiny, to build resilient systems, and to create a nation that doesn't just withstand a crisis, but also leads the way in solving them. We've lived through some real major crises in our lifetimes. And each one has impacted the way we live, the way we think, the way we act. Do you all remember mad cow disease? Remember that one? Yep, I stopped eating beef. You remember swine flu? Remember that one? I stopped eating pork chops. I moved to bacon myself personally. I hope that one is safe. Remember Ebola? And of course, COVID-19. We learned a lot of lessons. Allow me just to pick a few. One, it was about preparedness and early action to contain and isolate for better outcomes. Our health systems were vulnerable and they became overwhelmed. This underscored the importance of investing in a public health infrastructure. And the topic that I will most concentrate on, which is resilience and adaptability, perhaps the most powerful lesson that we learned over the crisis, the ability to anticipate these challenges, equipping with the right tools and knowledge to withstand and overcome them, to learn and incorporate these lessons and wisdoms to refine our approach, and then doing this over and over and over again and becoming stronger. So as I think of our role in private sector, and Safaricom no different in this case, Safaricom itself is on a path of transformation. We're a telecommunications company, but we have been morphing to a technology company and are on our quest to be the leading technology company in Africa by 2030. We partner and continue to partner with both the public sector and the private sector to provide solutions that transform lives through not only commercial enterprise, but also the work that we do through our foundations that touch millions of lives in this country. Just to give you a snapshot of some of the things that we've been involved in. In the last 5 years, we have partnered with the national government to facilitate the distribution of vouchers to subsidize fertilizer and farming inputs for millions of farmers in this country. In the last year, over 500,000 tons of fertilizer was distributed to this country, driving resiliency in the food supply. We supported Hustler, where over 23 million Kenyans borrowed over 52 billion shillings, which enabled young people and businesses to have access to low-cost, no-collateral credit. And in the last year, partnering with the Ministry of Health, we integrated a health management information system to digitize hospital management systems all over the country to provide at each and every hospital low-cost tablets, applications, and systems to digitize the delivery of care in every hospital. So far, we've also equipped over 100,000 community health workers who are providing a basic level of care and collecting patient data in every household they visit to ensure that we're collecting a treasure trove of data of our citizens that allow us to respond effectively in the case of a pandemic. We're also expanding rural connectivity with affordable solutions for every home so that no community is disconnected from digital healthcare, education, or economic development. To this extent, we are working with several partners to develop low-cost mobile devices. You heard me saying we cover over 97% of the country. These devices are below $50 that allows individuals to be able to access low-cost devices and low-cost credit to access them. We're supporting the government in connecting over 2,000 public Wi-Fi hotspots, many coming online, to ensure that connectivity is not a privilege, but a basic service for all. So connectivity is the backbone of a resilient healthcare system, as is the data infrastructure that supports it. This includes data centers and cybersecurity to efficiently store, analyze, and secure patient data within the country. And as we scale healthcare, it's important that the data we generate is protected and used responsibly and kept local. We are very grateful for the recently announced Kenya Cloud Policy, which will ensure that data is localized, protecting citizens' privacy and security. Ladies and gentlemen, the foundation is laid. We must scale, we must integrate, and accelerate. We're making healthcare faster, smarter, and more accessible. Let us commit not just to plans, but to outcomes, because resilience is not about the future, it's also about owning it. Thank you, ladies and gentlemen. We can do this. We can do it together. We can make a lasting impact and transform healthcare for this country, for this region, for this continent. The future is ours. Thank you so much.
Thank you very much, Madam Cynthia. Appreciate it. Let's give a round of applause as well, and to thank Safaricom for the great partnership. I'll also wish to recognize Madam Lucille Aveva, who's the Director, Customer Obsession, Safaricom. Thank you so much, the entire team. Ladies and gentlemen, we have a gentleman who I would say was a voice of reason during COVID times. I'm just trying to build momentum for the invitation of Dr. Githinji Gitahi, who's the CEO of AMREF Group. But as we mentioned, in terms of building perspective, building resilience, he's a man who's right in the center of that. So, Dr. Githinji Gitahi, if you can hear me, the floor is yours, joining us virtually from Nairobi. Over to you, sir.
Thank you very much. I hope you can hear me.
Yes, we can, sir. Go ahead.
Thank you very much. I've been listening for several hours here, the very conversation, and I'm really glad that I'm not part of this. So allow me, of course, to the coming protocols, the prominent presence of the Cabinet Secretary and the support we had from the Minister of Health all through, and this framework of health security. But also in Africa, other than this very rich ecosystem or ecological ecosystem, we have suboptimal health investment in the health systems. As I keep saying, in Africa, give or take, of course, countries are not the same, but on average, you will say that Africa spends about $40 per capita. That is $40 per person per year on health of domestic money, before you add, what you may call out-of-pocket expenditure by families themselves that makes them poor, and also from, development partners, which is now declining and threatened. So $40 is what we spend on our building health systems, which is everything that you talk about: supply chain, you're talking about health workforce, you're talking about laboratory systems, governance, everything. While the average in high-income countries is $4,000. So we have $40 to do the job of $4,000. So we, other than having this very rich, diverse ecological system that makes it risky for outbreaks, we have actually a suboptimally invested health system. And finally, we have socioeconomic conditions that deny our people clean water and sanitation, both critical for health security. So these factors make Africa at the center of global health security, as it were. And even as we listen to our colleagues from Nebraska saying, the approach of global security is global, the highest risk, including the low capacity for international health regulations, is actually in our continent, which makes it really important. This conversation also comes at a time when these risks are increasing due to global warming. We know that climate change is a kind of increasing disequilibrium in this ecological system. Secondly, it's destroying health infrastructure through extreme weather events, and also worsening socioeconomic conditions of our population through climate-related stress and poverty. And these coupled with debt distress now that is making it more difficult to finance the health system, and obviously from the last week or so, shifting geopolitical environment, including the recent significant changes in the U.S. government policy and the threat of the U.S. government leaving WHO, which then puts a risk on weakening the WHO as a key coordinator in the global health system, add to these challenges. And therefore, this summit for me is a watershed moment, which is why even if I couldn't make it to come in person, I really wanted to participate virtually to give my views, because it's really critical. We have seen from Marburg recently in Rwanda, many of you will know there were many conferences that were scheduled to happen in Rwanda last year. One is just coming up now, the NCD conference. We had a conference on food security and nutrition. All of them were cancelled because of the Marburg virus. So we know that this is not just health security, it's about economic security and also our global solidarity. So it is time for me that we move away from talk. Of course, there's a lot of talk on core capacities, measuring this. Africa is at 50% of core capacities of IHR, the lowest in the world. Countries are measured and they're working on this. But at what point do we move and act? We must act, and I think that this summit, my call is that we must move to action. And that action is framed in the following way in my mind, that whereas global health security is a global responsibility, the building blocks of global health security are national. And like a strong building, they have to be built bottom up. And I have three things to propose for building this global health security in a bottom-up manner. One is that communities must be the first line of defense. Is the communities that actually are standing exactly where the index states for any outbreak, emerging or re-emerging, is going to happen today. It is communities that are there. We saw community health workers involved in Tanzania in identifying the first Marburg case. A 21-year-old female community health worker trained, identified, or raised the first, not identified, but raised the first flag for the first Marburg outbreak. It is the communities that have to be the foundation as the first line of defense, and that's where we must invest. Secondly, is that we need primary healthcare systems as our second line of defense. And third, collaboration, regional, whole of society, One Health approaches as the third line of defense. And of course, the IHR sits within this complex, but communities must be at the center. For us as Amref Health Africa, we are working across the continent, and I see many member states represented here. We are working with WHO, AFRO, and of course the WHO in Geneva. We are working with Africa CDC. We are working with the private sector and all of you represented. We're working very closely with all the governments in Kenya specifically and also across the continent. And we continue to do so, and our focus will remain increasing human resources for health for the continent. And the one thing I'd like to say is, in line with this, we have focused on training health workforce for primary health care, with this in mind that you say they are fit for purpose for health security. And this year we will be launching our AMREF International University new campus, which is going to be 10,000 student capacity in Nairobi along Thika Road. An honorable minister will be reaching out to you for this. So that provides us an opportunity to bring students from across the continent to work with us in a context-specific training that actually provides more capacity for response to the health security needs of this region and for the world. Secondly, this year we are hosting the Africa Health Agenda International Conference 2025. We hold it every 2 years, hosted by AMREF, Africa CDC, and the Ministry of Health Rwanda and WHO. And we'll be coming up 2nd to 5th of March. I'm inviting all of you. We expect more than 2,000 delegates. And the key agenda will be to discuss social and ecological determinants of health. And these form the fabric of health security now and in the future. So beyond this invitation and beyond my participation here, I hope that this conference, this summit, the outcomes will be taken forward to our EARGHSS 2025 in Kigali, and that we will continue to work together for action, not just talk, and making sure that communities are the center of local and global health security. Thank you very much, ladies and gentlemen, and thanks for having me. And to my colleagues at AMREF, thanks for participating, for being part of making this happen.
Thank you, Dr. Gideji Gitai, CEO, AMREF Health. Thank you so much, sir, and thank you for joining us virtually. Let's give him a round of applause, please, ladies and gentlemen. As we transition to the next presentation from BioVax, I'm told by my co-MC, the Principal Secretary, Public Health, that we need to be a bit energized. So please put your belongings on the table. Let's all stand. I know I'm speaking to a lot of doctors here, medical practitioners, and we need to do a small stretch. I would advise that we want to really make sure we can catch up on the progress, so we'll not take a formal break per se. So this stretch is very simple, and I know we did it in Vipingo a while back. How do you spell coconut? And sorry to ask professors, dons, and how do you do coconut? Okay, clearly. Dr. Thacker, you got it. So see the first, see the C to the right, the C to the right, like to your right, to your right. Hey, okay, to your right, ladies and gentlemen, right? Your right is on that side. Okay, that's a C. And then O, that's an O in the middle. That's the O in the middle there. Yeah, there we go. And then there's a C to the left, to your left, to your left. To your left, yes. And then there's an O there in the middle. And then we have an N, just like that. That's an N. And then the U. That's the U there. The U, and then we have the T. So let's do that in quick succession. Coconut. Let's go C, as you say C. C, O, C, O, N, U, T. Oh, you're very good students. Thank you very much. You may take your seats at this point in time. And before I just now dispense with the various protocols, we'll hear from the Africa CDC and the World Health Organization and the Principal Secretary. And of course, we cannot wait to hear from our keynote speaker, our Cabinet Secretary for Health. So ladies and gentlemen, allow me to invite on stage Dr. Swarup Rajan Mishra, who's the chairman BioVax, for a quick presentation. And at this point, I'll recognize the BioVax team as well. I think we've worked closely in various health initiatives in the region. So already glad to see Roberta as well, the Tari, and the entire team from EARGHSS. We had great conversation. So at this point, we want to just hear from the chairman to represent you all on the various initiatives. If we could have his presentation loaded up, please.
No, you have the presentation. Thank you. This one is okay. Thank you very much. Good morning, everybody. I'm from Kenya. Before I speak, all protocols observed. Good morning. I have two mothers. The mother who gave me birth is India, and the mother who bring me up is Kenya. So, I am very fortunate to have two great mothers. Thank you. So today, we will talk about biohacks. Is it a wrong one? Sorry, this is the wrong one. Presentation. Okay. Okay. Sure. Yes. Can you take there? Okay. I'm sorry. This. Okay. This is the gentleman who pioneered the vaccine concept in the world in the year 1795. He's called EARGHSS. Our President of Kenya, Excellency Dr. William Samoei Ruto, says local manufacturing is essential to universal health coverage. Having local manufacturing capacity is insurance for us of supply even when we have difficult times globally. Sorry, there is a technical hitch here. When COVID-19 pandemic occurred, we came to know the COVID told the whole world, in spite of the developing world, developed world, underdeveloping world, all the state of nation or the country's relevancy as far as preventive healthcare, curative healthcare, vaccines, pharmaceuticals are concerned. Africa imports 98% of vaccine requirements. Kenya currently imports 70% of pharmaceuticals and 100% vaccines. That led, there are three aspects why Kenya gave birth to biohacks. Now, biohacks was born in the year 2021 because of three reasons. Reason is, in 2019, the Gavi wrote a letter to Republic of Kenya that after 10 years, that is 2029, December, they are going to stop giving vaccine to Kenya. Either we buy or we manufacture. Number one. Number two, the cause is pandemic COVID forced us that today in the new frontier in the world, pandemics are not new and it will come again and again. Number three, our president and government of Kenya, the beta, the bottom-up transformation of economic transformation agenda led also to make the vaccine formation in more stronger nowadays, now at the current time for vaccine in Kenya. The vision of biohacks is to make the world free of vaccine preventable diseases. The mission is to manufacture and commercialize the vaccine and other health products effectively, safe and quality oriented to not only to Kenya but whole of Africa and other parts of the world. The current production capabilities which is ongoing, in the first phase we are going to do 80 million doses per year, 80 million doses per year. And our expansion is in two types, two levels. Stage one is in Embakasi, Nairobi, which we are going to fill and finish by the end of 2026 December, God willing. The another phase is going on end-to-end production. that is in 3 phases: cold storage, fill and finish, and end-to-end manufacturing with animal farming, a complete manufacturing by 2030. And we are proposing to do it in Eldoret, in the Rift Valley, the best weather in the world and the best athletics where come from in the world, Eldoret, where I come from also. Let me tell you, very few people know what is the meaning of Eldoret. Eldor means stony hard water. It is a Maasai name. Tea, in Kalenjin, we say tea because every word we put tea. Kabiet, Mosoriat, Kapsabet, Eldoret. So that's the reason its name is called Eldoret. Thank you. So February 2019, as I told you, the Gavi wrote us a letter. So that is the initiation of the thinking, brainstorming, and thought process started in Kenya to manufacture a vaccine at home. February 2020, the commissioning of study of local vaccine manufacturing. Then March 2022, all these COVID-19 impact on global supply chains and health commodity security. Then December 2020, feasibility of vaccine production in Kenya is done. Then February 2021, the multi-agency committee was operational, and then September 2021, the BioVax was born. So you see the timeline with all the events which is going on. So 2027, fill finish, production, portfolio expansion, market access, research and development, end-to-end manufacturing. And that we are thinking it will be finished by 2030. And as you know, we have done also Kenya. We got into November 2024 in the Health Emergency Preparedness, Resilience and Readiness Project. It's a multi-country and multi-agency project which Kenya is already incorporated. Our strategic partners on the headline of this, one is regulatory organization, production quality, and market access. That is, we required from WHO, IVI, International Vaccine Institute, locally also, KEMRI, and and also Pharmacy Provision Board, and National Quality Control Laboratory. Industry, drug substances, API, and packaging, energy, financing. So these are required a lot of, like financing, we need World Bank, we need IVI, we need IFC, and now Korea Exim Bank is already partnering. So drug substance APIs industries like Biopharma Indonesia, Serum Institute of India, then Korean company called Bioscience, SK Bioscience, and other IVI, other companies are coming up. Also locally in Africa, we need collaboration from other African countries, like from Kenya, the National University of Defense, the Kabarak University. So we have a lot of collaboration. And today, with all these African countries, we have to sit down and together that Africa, it is not a rocket science to do vaccine in this world. When I came to Kenya in '97, we sent patients for a joint replacement, for a fracture to another country and continent. Today, Europeans are coming to Kenya to do kidney transplant, liver transplant, open heart surgery, replacement surgery, transplant surgery, and also navigated neuron spine surgery. So imagine, Kenya is the destination. Eldoret, people are coming from Israel, people are coming from Germany, from Switzerland. So it is not a rocket science. When Kenya Airways were there, the pilots were from Spain, from Britain. Now 100% of our pilots are from home. So it is the psychology. What mind doesn't know, eyes cannot see. So research and development, technology transfer, intellectual property. We want to partner with America, US, United States Orthopia, then also IVI, other institutions we want to partner. One thing, Madam CS is here and Madam PS is here, the government of Kenya. This is our local help we need for vaccine. One is, we want from the government of Kenya the advanced procurement promise and agreement. 1 billion shilling, Kenya shilling, that is $10 million every year. We need a promise to buy the vaccines from our BioVax. Without that promissory, we cannot achieve the funding and the recruitment and technology transfer. Number two, embassy site should be given to, formalized to BioVax. Then exemption of the tax to the products and our vaccines. That's we wanted from you, Madam Excellency. Number four, we need the recurrent budgetary 700 million shilling and 600 million Kenya shilling for the development budget every year from Kenya government. Then also, we need ML3, maturity level 3 from Pharmacy Poison Board to achieve the regulatory of vaccines and other biological products. Kindly, madam. Without that, we won't never be identified or recognized or respected internationally. Then, of course, upgradation of the national quality laboratory, upgradation for better HR and better efficacy and technology. Thank you very much. This is our way forward. The infrastructure, as you're seeing, we need the land also, which we have got 100 acres land for in Eldoret by the governor of Uasin Gishu. 100 acres and another 100 acres. It is yet to be approved and finalized. And last signature we want from His Excellency President. So Eldoret, as you know, Eldoret is the proximity of 6 landlocked countries of Africa. Sudan, South Sudan, Uganda, Rwanda, Burundi, Congo, and Congo-Brazzaville. So Eldoret is very strategic doing business. You know, so the thing is that we want supply chain, cold chain, equipment, machinery, research and development. Without research and development, nothing can be possible. No clarity, international accreditation, recruitment of best knowledge and brains, and recognition of the international community cannot be achieved, and business development cannot be achieved without R&D. And we want to do state-of-art biological, biotechnology and biopharmacy and bioimmunology center in our BioVax. Of course, talent acquisition, manufacturing contact, commercialization, and G2G agreement between African countries to African countries we need. We think Africa, we don't have brain. We have enough brain, but now brain has already drained. We have to gain the brain. Instead of brain drain, we have to have brain gain. Thank you. All the African brains, they have gone to Europe and Western world, but now Africa, the time is for Africa, for Africans. We have to bring them back with good remuneration. If we don't pay them well, why Misra is here? I came 30 years, 25 years back. I got more money than India here. So I was, so the thing is that, please, we need better remuneration. This is the present current situation of our ongoing fill and finish project, which will be finished by 2026 December. And that is our dream project in future way forward for BioVax in Kenya for Africa. Availability, affordability, accessibility, and acceptability with vaccine manufacturing is the way forward of universal health coverage for each and every one and all Africans and Kenyans in this world. Strengthening global health security requires collaboration across the borders. No country can tackle health threats alone. We must work together to build resilient health systems and invest in preparedness to ensure that we can respond effectively to future health crises. By great quote of our President, Excellency Dr. William Ruto, the father of health in Africa. Thank you very much.
Can we please give a resounding appreciation to the chairman, BioVax, Honorable Dr. Mishra. Thank you very much for the presentation and a great challenge there. Ladies and gentlemen, as we transition, allow me now to recognize as well, just one more time, one of the partners who believed in this team as we were coming up with this conference, the Robert Koch Institute, that's RKI. Can I see the representation, RKI team? Thank you so much for the support and for believing in us. KEMSA, East African Medical Vitals, BioVax, Safaricom, and Revital. Another resounding applause, please, to those partners, thanking them very much. And at this point in time, as I mentioned earlier, I am now honored to have a co-MC. So it's my absolute pleasure to invite on stage Madam Mary Muthoni Muriuki, who's the Principal Secretary, Public Health and Professional Standards, to come on stage, recognize the Africa CDC team, the World Health Organization, and of course, invite our Cabinet Secretary on stage. Madam, karibu sana.
Asante sana, asante sana. Madam CS, Monsieur Minister for Health, ladies and gentlemen, allow me to ride on the protocols, and my dearest sister, the Deputy Governor of the great county of Kilifi. Good morning. Is it morning or afternoon? Just on the dot. So good morning, good afternoon. Hello? Okay, let's be on our feet for 1 minute. I know it's been a great morning, but we can make it even better. So I want us to come to Mombasa from Kisumu. So where's that mic? So when I say you go to Kisumu, you know Kisumu is on the upper part of the country, or is it west? And when I say you go to Nairobi, you know Nairobi is in the middle of the country. And when I say you go to the coast, you know the coast is at the bottom. So when I say Kisumu, you touch your head. When I say Nairobi, you touch your waist. And when I say Mombasa, you must go down. So Kisumu, let's do the practice. Kisumu, Nairobi, Mombasa. Kisumu, Nairobi, Mombasa. Kisumu, Nairobi, Mombasa. Kisumu, Nairobi. Nunua manguo hapo Nairobi. Nairobi, Mombasa. Mombasa ogelea. Mombasa tena. Mombasa. Kisumu, Nairobi, Mombasa. Kaeni chini. So, Madam CS and Monsieur Minister for Health for Comoros, thank you very much. Ladies and gentlemen, karibuni sana in Kenya, and we are grateful to host this event today. We are looking forward to the best resolutions that we can have as we continue to make the health agenda in our country, in our neighboring countries, and the society as a whole a better place. In the recent years, and especially in East Africa, you realize that we have emerged as an epicenter of emerging infectious diseases. And this underscores the critical need to build strong partnerships to address this. This region must confront the challenges head-on, including threats posed by pandemics, bioterrorism, and environmental factors that contribute to the rise of new diseases. And that is why, at this juncture, I want to take this opportunity and invite my very good friend, WR, to come and tell us more during this forum. How do we go about this? WR, karibu.
Thank you very much, my friend and sister P.S. Marim Tony, Madam P.S., honorable ministers and ministers representatives present in the room, county governor representatives, partners from the University of Nebraska, Africa CDC, AMREF, BioVax, Africa Health Business, the chairperson of Kenya Vision 2030, Dr. Emmanuel, and ladies and gentlemen, if there is one thing that I learned from working in government and the UN, it is to say all protocol observed. So all protocol observed. Please allow me to write on the protocol already, understanding protocol. But I do want to acknowledge a colleague of mine who did not get a chance to meet those who were in the holding room in the morning, who's representing our regional office, my brother Dr. Francis Kasolo, who is the director of WHO's office at the African Union, and EAC. So it is a real pleasure for WHO as a co-convener of this event to be here today and join all who've already spoken in welcoming you to this very important summit. And for me, as WHO representative in Kenya, it is an honor for me to stand in front of you and equally welcome you here. Ladies and gentlemen, this is a great opportunity to strengthen partnership, as everyone said. It is an opportunity for us to look back in the mirror, discuss lessons learned, best practices, and also honestly discuss gaps in what we have been doing, and more importantly, discuss perspectives, way forward, the future. People keep referring to the COVID-19 pandemic. Yes, I think it was a great experience. I think we learned a lot from that outbreak, but allow me to go one step behind the Ebola disease outbreak in West Africa, in Guinea, Sierra Leone, and Liberia, where a lot of the subjects, a lot of the themes that we'll be discussing today actually started. For me, some subjects that are really, really important to mention as we start our deliberations in this important summit. The first thing is surveillance. I just want to strengthen the importance of surveillance. And when I say surveillance, allow me to go back to the beginning. Community-based surveillance. So the ability of people within the communities to just detect and report unusual events happening. Just to say that in this household here, something happened. 2 different people actually got sick. Or unfortunately, 2 different or 3 different people just died. It's true. We talk about innovations, we talk about advanced surveillance systems, but ladies and gentlemen, it starts there. So I just would like to stretch that importance as we discuss global health security. We can spin around, talk about many things, but diagnostics is another important subject. If I go back to the Ebola disease outbreak in West Africa, many of you don't know, but actually the diagnosis was not even made on the African continent. It was Lyon that confirmed that what we were up against was actually Ebola. Of course, the landscape has changed since, but we still have a lot to do in terms of making sure we have innovations and that different diagnostics tools that we have are readily available and where they are needed for our communities and services. Information sharing. There's no one single nation that can actually individually and in isolation deal with a pandemic. Information sharing is critical, and I think my brother Gitinji stretched on this here, so critical. And of course, primary health care and community health. That's another important subject. Going back to what we learned from the different outbreaks, the importance of community infrastructure, community health system is fundamental. In fact, like I said, I always like going back to that Ebola disease outbreak. The reason why it was really bad, it was severe, by the way, you all know what the mortality rate is for Ebola, was simply because at the community level, the system was very, very weak. The healthcare professionals at that level had their guards down. They didn't know what they were up against. By the time they realized what they were up against, it was already too bad. So it's really important and critical to invest in primary health care, particularly community health system. One other important aspect, when we face an outbreak, we always think about epidemiologists, we think about doctors, pharmacists, lab specialists, and so on and on. We think technical, we think various aspects of public health. We forget often one thing that is fundamental. It is the role of social anthropologists. So a couple of people came here and talked about focusing on the communities that we work with. It's critical and important to know the communities that we work with. There are so many stories that I would like to share with you, but for the sake of time, I'll spare you those. But just to mention a few. Here's Ebola, started in Guinea before it spread to a couple of countries. Everyone reacted, people are dying, let's send them body bags. In a Muslim predominant country, the first body bags that were sent there were all black, completely black. So people saw that, they're not used to seeing their relatives wrapped in something black. So you know what they did? They simply decided to hide people who were dying within their houses and take care of the burial. The result of that was actually fueling the outbreak and just making it worse. And so many little things, without judging whether one thing is right or wrong. When a pregnant woman dies while pregnant, exactly, so do you bury her with the baby? Do you extract the babies? Different beliefs, different understandings. I'm not saying this is good or bad, but it is just fundamental and critical to understand the communities that we work with. For the Ebola disease outbreak, having been the Minister of Health of Guinea, I can tell you that it wasn't until we got social anthropologists involved that we actually made a difference. So I would like to kindly invite us as we deliberate here to maintain that component of understanding our communities. Today, there is no way we can talk about any subject, be it global health security, without talking about climate and health. So just want to stretch that as well. Kenya, by its location, is part of the Greater Horn of Africa. Kenya is a gateway to many landlocked countries. Kenya has multiple points of entries with neighboring countries. So not to mention the climate influence on many aspects of the life of Kenya. Water, when there is too much water, it is a problem. When there is no water, it is a problem. And in Kenya, we have experienced drought. Colleagues from the Ministry of Health are here. They know what we went through, and everyone in this room from Kenya knows the consequences of that. And then the rainfalls, right? March, April, May. The flooding that we went through last time and the consequences of that as well, just to mention a few. So finally, something that I just want to stretch, and the chairperson of BioVax mentioned it, we can't discuss about our continent or our region today without talking about local manufacturing and supply chain management, particularly harmonizing policies across the region and across the continent, because it starts there. WHO has always a privileged partnership. Partnership is pretty much the way we operate, and something that we value. In terms of global health security, we've been closely working with many partners, but particularly Africa CDC for the region, at least. One thing that I want to mention is the WHO flagship initiative in global health security, which is, some of you have heard of PROSE. tasks, transforming African surveillance, search, strengthening the utilization of response group. And WHO partnered with Africa CDC to come up with search, ad hoc search, which is building the capacity of emergency responders. We've trained hundreds of emergency responders together who are readily available for our region to address some of the challenges that we've been talking about. I've just used that as an example, just again, to stretch the importance and relevance in partnership in what we do. The role of private sector. This is a personal and very dear thing to me. I keep hearing domestic resource mobilization. Many people like that as a buzzword. Many people like talking about countries actually mobilizing their own resources from within the government. I think my brother, the Minister of Health of the Comoros, just gave us a good example. For those of us who've sat in budget arbitration, we know what the priorities are. Some of the countries that carry the highest burden of disease, including the Sahel countries, when you sit in budget arbitration, the priority is security. Right? By the time you get to the health sector and you start getting into the sublines and sublines, what you have available is gone. So it is critical and fundamental that we tap into private sector resources. And when I say private sector, it's not just the backyard private sector that is, of course, important, so pharma, manufacturing, and everything, but there are many other avenues and opportunities in terms of private sector that are there, and we heard some, we heard CARICOM and others. So I think it is a great time for us to move away from just using that as a buzzword, but actually deliberately engage private sector and bring them into what we do. So I don't want to stay here for too long. And again, we see this as a great opportunity for us to come together, discuss these important subjects. I would like to wish everyone excellent deliberations, and as we always say in such a gathering, learn, network, and more importantly, have fun. Thank you very much.
Asante sana WR. And having listened to you, we find Africa in itself at crossroads of progress and vulnerability. And over the past 2 decades, you realize that the continent has made notable strides in combating major infectious diseases such as HIV, malaria, tuberculosis. However, the frequency of emerging infectious disease outbreaks has steadily risen. Events such as Ebola outbreaks, Mpox, and these have exposed the systemic weaknesses, disrupted healthcare systems, and hindered economic progress. And that is why these challenges have drawn increased international attention and prompted action. Institutions like yourself and Africa CDC have emerged as critical players, providing leadership and coordination for health security on the continent. At this juncture, I want to appreciate my very dear sister, her name is long, from Africa CDC, who we have been working with. Just wave to the crowd. We have been working with very, very closely. Please, a round of applause for my sister, and to allow me to welcome Dr. Raj Tajudia, the Deputy Director General for Africa CDC, to tell us more about these challenges that we are going through as a country, and where do we, what next? You are a very, very critical player in this, in providing leadership, coordination for health security and all in the continent. Most welcome, sir. A round of applause.
Thank you so much. Good afternoon, Your Excellency, the Cabinet Secretary for Health, Kenya, Your Excellency, Minister of Health from Comoros, Excellencies, other ministers in the room, head of our delegations, my brother and friend Gidichin Gitai joining us virtually. All protocols are duly observed. Let me also use this opportunity to acknowledge the WHO leadership, from Dr. Diallo to Prof. to Ambrose. Thank you for your partnership. So allow me to convey apologies from the DG, Dr. Jan Kaseya, who actually up till 48 hours ago was scheduled to be part of this critical discussion. But as we are all aware, our head of state and government, in less than 2 weeks' time, they will be convening in Addis Ababa. So because of that, he has to stay back, in preparation for that summit of our head of state and government. Colleagues, ladies and gentlemen, we learned so many lessons from COVID-19 pandemic. And I'm sure, you've heard some other colleagues talking about this. But one of those lessons is the importance of regional platform, importance of regional mechanism to complement the multilateral arrangement. Talking of Africa CDC and working with those UN agencies that were set up a couple of years ago, talking of 75 to 78 years ago. One other thing we learned is the need to begin to look at that global health space in a different way, talking of new public health order. So as part of the response to the COVID-19 pandemic, and as part of building the capacity of our member states, our head of state and government called for the need for a new public health order. And I'm sure most of us are aware of this, but for point of emphasis, this new public health order is underpinned by 5 critical pillars. Number 1 is to strengthen our public health institutions across the continent. Talking of the regional institutions like the Africa CDC, the regional WHO offices, talking of the regional institutions like those health institutions attached to our regional economic communities. And at the national level, we are talking of our National Public Health Institute, of which, of course, I can see some of the Director Generals of those MPHIs, across the room. Number 2 is the need to build capacity for health workforce, best in class, fit for purpose health workforce. With that health workforce, there is no way we can guarantee the health security sovereignty of our member states. Number 3 is to build local manufacturing capacity for health security commodities. Talking of vaccines, talking of diagnostics, talking of therapeutics. Of course, we've listened to Biovax, so I will not dive deep into that. But colleagues, just to put that into perspective, at the onset of the COVID-19 pandemic, we only manufacture 1% of our vaccine needs on the continent. 99% is imported. Fast forward along the line, we were supposed to be importing the COVID-19 vaccine meant for the continent from India. India shut down. So we were made to wait at the back of the queue. We were made to wait or to continue to scramble for the leftover after some countries have benefited multiple times over. So hence the need to build local manufacturing capacity for health security commodities. Let me at this junction thank the government and people of Kenya, especially His Excellency President William Ruto, who is the AU champion for the local manufacturing agenda. Number 4, on our new public health order, is around domestic resources for health. Talk of health financing. I think that agenda has reached a critical level now, especially with what is happening as far as global politics is concerned, without mentioning names. So in this regard, our leadership, talking of the political leadership on the continent, are taking the bull by the horn. And come February 14, under the leadership of President Paul Kagame of Rwanda, I think we'll be looking at that agenda in Addis Ababa, Ethiopia, and we'll also be diving deep into what sort of innovative financing, what sort of alternative financing should we be looking at to manage this crisis as far as health financing is concerned. The 5th pillar under the new public health order underpin what we are going to be doing here for the next 3 days. Talking of respected, action-oriented partnership. A partnership that brought colleagues from University of Nebraska, to join us today and the next couple of days to discuss global health security as far as the East Africa region is concerned. Partnership that will allow us to leverage the private sector, talking of Safaricom, the manufacturing and the extractive industry. So we know that whether we like it or not, we need that respected, action-oriented partnership to really advance the discussion around health security. Colleagues, ladies and gentlemen, Africa CDC was set up around 8 years ago, and I'm glad Dr. Diallo is here. He was one of those excellencies, that really sit down to shape the agenda, around the Africa CDC, establishment. Colleagues, our DNA at Africa CDC is around emergency preparedness and response. Talking of pandemic prevention, preparedness and response. But we know that to be able to guarantee pandemic prevention, preparedness and response, you also need a very strong primary healthcare system, because every disease outbreak begins and ends in the community. Therefore, our strategic priority as Africa CDC is around, one, supporting member states to have in place a very strong, resilient, epidemic-ready primary healthcare system. A PHC that is able to detect, that is able to prevent, and be able to respond to an outbreak. A healthcare system that is able to protect healthcare workers. A primary healthcare system that is able to work with organizations like Safaricom to leverage the digital apparatus at the disposal of, the telecommunication giants on the continent. A primary healthcare system that is able to interact with the community. So this is sort of, a PHC agenda that Africa CDC is pushing for. Dr. Diallo already talked about surveillance. That is very, very critical. Again, how do we leverage that 80% digital or mobile penetration to advance surveillance? How do we leverage the 50% internet penetration on our continent to strengthen surveillance? How do we ensure that our community are part and parcel of the surveillance system? Today, we continue to fight mpox. One of the greatest challenges is a very weak surveillance system. So I think going forward, we need to put our heads together to see what sort of surveillance system do we need to put in place. Let me also mention that apart from surveillance, we also continue to work with member states to put in place a coordination mechanism around management of outbreak. Talking of Public Health Emergency Operations Center. And our head of state and government under the president of Zambia has issued a call to action, to support member states to build a very strong, robust Public Health Emergency Operations Center so that we're able to coordinate better whenever there's any outbreak. Number three, colleagues, ladies and gentlemen, is around establishment and strengthening of national public health institutions. We need to move away from setting up ad hoc committee whenever there's an outbreak. We need to have in place institutions that can be drawn upon whenever there's an outbreak. We need to have institutions that can be able to generate evidence, that will guide the way we respond to any disease outbreak. Number four, lab systems and network. Africa CDC will continue to work with our member states to strengthen our lab systems, including pathogen genomics capacity. When COVID-19 struck, there were only 2 countries out of 55 that had the capacity, to diagnose and type the COVID-19. With support from Africa CDC and partners, including WHO, we were able to move that needle from 2 over 55 to 48 over 55 before the end of the year. Local manufacturing is critical. DG Dr. Jean Kaseya has described that as the second independent of Africa. You cannot guarantee air security when you continue to import the vaccine need for 1.5 billion people. It's not possible. In fact, President Paul Kagame said, and I quote, "You cannot guarantee air security through goodwill. You have to be seen to be very deliberate, around this." So local manufacturing is critical to our agenda. Colleagues, ladies and gentlemen, workforce is critical. Gitinji talked about primary health care workforce, but community health workers, because whether we like it or not, as I said previously, every disease outbreak begins and ends in the community. And the need for us to go back to that, our head of state decision of 2017, when they call on each and every member state to prioritize the institutionalization, professionalization, integration of our community health workers, and to train and deploy 2 million community health workers, so that at the end of the day, for every 500 to 600 people on the continent, you have one community health worker. One community health worker to be able to support, their health needs. Of course, epidemiologists are in short supply, medical doctors, nurses, and so on and so forth. So a fit-for-purpose, best-in-class workforce remain critical to really advance our health security agenda. Lusaka agenda, how do we ensure that the global health initiatives, talking of Gavi, talking of a global financing facility for adolescent, maternal, newborn, and child health, talking of global fund, how do we optimize the resources that are coming through these global health initiatives? How do we make sure that these resources do not just come to support us, but they are able to unlock the domestic resources, in the spirit of localization, in the spirit of one country, one plan, one team, one budget. So this is a discussion that we really need to put our heads together, and I'm glad to inform you that as Africa CDC, we have decided to host the Secretariat for this Lusaka agenda. Again, we need to find a way to optimize these scarce resources, as far as the global health space is concerned. To conclude, ladies and gentlemen, local manufacturing is critical. Digital health, data science is critical. Without data, we are flying blindly. So capacity around data science in such a way that we're able to leverage the digital infrastructure on our continent is critical. Number 3, universal health care. True, strong, resilient, pandemic-ready primary health care is also critical. And last but not the least, our head of state and government have called for Agenda 2063, the socio-economic blueprint for the 1.5 billion people on this continent. Without air security sovereignty, without universal health care, we will not be able to achieve that, the Africa we want. I thank you.
Thank you very much. I didn't see you closing. Ladies and gentlemen, as a country, Kenya stands as a testament to the determination to achieve transformative health goals. And this is guided by the bottom-up transformation agenda. And the country has a result in its pursuit to universal health coverage. And this vision underscores equitable healthcare access and financial protection for all, ensuring that no Kenyan is left behind. Maybe in the near future, we will be talking about nobody in this region is going to be left behind. And that is the vision that we are securing today. And as the host to this inaugural summit, Kenya affirms its unwavering commitment to strategic leadership, governance, and collaboration in advancing the global health agenda. As a country, I have had WHO, Dr. Githinji Gitahi. We are talking about community surveillance, which is backed up by data that is credible. And as a country, I know we have rolled out 107,831 community health promoters. We have trained them, we have kitted them, and we pay them a stipend. And we have equally bought them a smartphone to ensure that data that they collect from the field is filled into the electronic community health information system. This data probably we should get to a point that we are sharing amongst ourselves to know some of the emerging and re-emerging issues in society. That is why at this juncture, I would request each one of you to stand on your feet, and we welcome my waziri, my boss, and the Cabinet Secretary for Health from Kenya to wind up this session for us this afternoon. Karibu sana waziri. You clap until she gets to the podium.
No, thank you so much. Please, let's take our seats. Your Excellencies, distinguished guests, ladies and gentlemen, it is a great honor and privilege to welcome you to the inaugural East Africa Regional Global Health Security Summit. This momentous gathering underscores our shared commitment to addressing one of the most pressing challenges of our time, ensuring the health security of our people and safeguarding our African continent against emerging global health threats. Allow me to begin by extending a warm welcome to all the distinguished leaders, delegates, and experts who have traveled from near and far to join us here today. Your presence is a testament to the collective resolve we share in building a healthier and more resilient future for our region. Excellencies, as we convene here today, we are reminded of the profound impact that global health security has on our societies, economies, and shared aspirations. The recent global health crisis, including the COVID-19 pandemic, have highlighted the vulnerabilities in our healthcare system and the interconnectedness of our world. This experience has taught us valuable lessons about the importance of preparedness, collaboration, and innovation in responding to health emergencies. In the East African region, we have witnessed firsthand the resilience of our communities and the dedication of our healthcare workers in times of crisis. However, we cannot afford to be complacent. The threats posed by the infectious diseases, antimicrobial resistance, climate change, and other health challenges require a united and proactive approach. Ladies and gentlemen, this summit serves as a platform to reaffirm our commitment to strengthening health systems, enhancing surveillance capabilities, and investing in research and development. It is also an opportunity to explore innovative solutions that leverage technology, partnership, and local expertise to address our unique challenges. As the champion for local manufacturing of vaccines, therapeutics, and diagnostics, we will aim to advocate for and support the development of local capacities in medical product manufacturing across the continent. The government of Kenya has taken significant steps to enhance our security framework. This includes investing in healthcare infrastructure, where we have prioritized the development of modern healthcare facilities, equipping them with the necessary tools and resources to respond effectively to health emergencies. Secondly, strengthening regional collaborations, where Kenya remains committed to working closely with our neighbors to extend knowledge hubs, share resources, and best practices in health security. Third is the capacity building, where we continue to invest in the training and development of our healthcare workers to ensure they are well prepared to tackle emerging health threats. The public-private partnership, where we recognize the critical role of the private sector in advancing health security, and the fostered partnership to drive innovation and resource mobilization. In community engagement, we are empowering our communities through the Community Health Promoters Program to take an active role in promoting health awareness and resilience. Excellencies, this summit is a call to action. It is a call to move forward and translate our commitments into tangible results. Let us embrace the spirit of partnership and solidarity as we work towards a common goal, a region that is better prepared, more resilient, and capable of withstanding future health challenges. Thank you, Your Excellency, again, Africa CDC Deputy Director General, for talking about global health security and universal health coverage, which is indeed a key to achievement of this. And so I urge all of us here today to seize this opportunity to foster meaningful dialogue, forge new partnership, and develop actionable strategies that will shape the future of health security in our region and beyond. In closing, I wish to express my gratitude to the organizers of this summit for their tireless efforts in bringing us together. I also thank all the delegates for their dedication and contribution to this important cause. Together, let us build a legacy of health security that will serve as a foundation for sustainable development and prosperity in East Africa and the world at large. Thank you, and may this summit be a resounding success. Thank you. Asanteni sana.
Thank you very much, Madam. Another round of applause, please, to the Cabinet Secretary, Minister of Health. Thank you so much for your time that you've dedicated to be here. Madam CS, thank you. I will invite you to your seat as well, just for another few minutes as we transition into a breakout. Ladies and gentlemen, allow me to call back Dr. James Lawler, who's going to be giving a clear catalytic perspective, lasers, and after which we'll have a group photo and then transition into the breakout. So welcome, James.
I'll use this one. Thank you. All right, so now we've had a number of talks and people are getting ready for lunch. Hopefully the temperature in here is getting a little cooler, so I thought we would liven things up a little bit. I see my assistants from the Global Center for Health Security are handing out laser pointers. If we could bring the lights down, please, in the room, and also kill that lamp. We're going to be projecting onto this wall. So, as I mentioned in my earlier comments, one of the lessons that we have really received in our discussions with stakeholders here, and one of the takeaways that we have from the pandemic, is the fact that empowering communities is the key to pandemic preparedness and to being able to respond. And I want to demonstrate what happens when you empower a distributed system. So we tend to focus many of our efforts in health security, and I think in global health, in top-down hierarchical approaches, where we have a head, which for a country is at the national level, and then we have international organizations, and we create strategies and visions and plans, and then we direct down from there and send direction, and we receive communication back up. But we end up with this very rigid and hierarchical system. And that often works in many instances, but when we encounter emergencies and things get complex, hierarchical systems tend to break. They tend to fail. What's interesting, however, is if you create distributed systems, when complexity happens, a phenomenon called emergence often appears. And it's where distributed systems can do amazingly complicated things much more effectively. And so we're going to hopefully get a demonstration of that today. I will confess, I've actually never done this before. I think it's going to work, but we're all going to learn a little bit. So those of you here on this side of the room, and a few of our honored guests are going to be receiving laser pointers. Hey, Vicky, come on, it's not Christmas. Come on. We're going to try and have people who have laser pointers, if you can move from kind of this part of the room to the left temporarily. So honored guests, if you wouldn't mind on this side, because otherwise you're going to blind me. If you wouldn't mind moving over here to this side of the room, and we can then have a safe exercise. Can I get the next slide here? I think we have some of our next slide. All right, here we go. So here's some instructions for you. Oh, thank you so much. Easy instructions. So there's two types of laser pointers. We have the silver ones, which I think many of you here in the front rows have, and we have the black ones. So the silver ones, you need to click the button 3 times to get to a red laser dot. Okay, so when you do that, you don't need to hold the button down. you just get the laser dot, and then you click one more time to turn it off. So you can practice on the ceiling. If we can bring the lights down a little more in here, that would be great. So distinguished guests here in the front row. Can I have you stand up, please? Thank you so much. Emmanuel, can you lead them over here? We're going to have this distinguished group congregate over at this side. Again, this is more for my safety, so I don't have lasers shining in my eyes. The black lasers are easy. They're self-explanatory. You press the button and hold it down, and you get a dot. Again, the silvers, you have to press 3 times to get the laser dot. Wonderful. All right, so silver, you press 3 times, you get the dot. Black, you just hold the button down. Please don't look into the lasers. Over on, yeah, that side, if you don't mind, so that you're not directly in front of anybody. Yes, thanks, Emmett. All right, please don't look into the lasers. Don't shine your laser into somebody else's eyes. If we could, Emmanuel, can you put him over on the side, because otherwise they're going to block everybody behind them. Thank you. Over on the side. Can we all move to the very side over there where the table is? Hi. We're going to move here. Yes. This way, this way, this way, this way. Everybody who's standing, please go that way from me. Thank you so much. Wonderful. All right. Now again, try not to blind your colleagues with lasers. All right. Everybody here, you're gonna get lased in the back of the head if you're standing here. Can you all please move over here? Kadeli, can you back up a little bit, please? Yes, please. You all, please. There we go. Good. Keep moving, keep moving, keep moving, because we have folks behind you here who also need to project lasers. Can you all please keep, there we go. All right, almost there. Sorry, sir, can I ask you to move a little bit this way so we can clear the way? All right, I think we have a clear line of sight. So what we're going to do is on this wall, right here where you can see, I want everybody to shine your dot. We're going to have 2 colors. All right, everybody shine your dot on this wall. Everybody with the laser. All right, look, there we go, good. Everybody with the laser, shine your dot on this wall. All right? I want you to make a circle. Make a circle. No. Everybody individually is part of the circle. So your laser should be still. Your laser should be still. But together you should make a circle. All right? Yep, slowly, slowly. All right, everybody's laser shouldn't be moving around. If your laser dot is moving, you're doing it wrong. Keep your laser still and start making a circle. Let's see if we can congeal into a circle. A bit of a smaller circle, a bit smaller, a bit smaller, a bit smaller. Good. There you go. If you need to stabilize your laser with your hand, you can do that. So you may want to use the 2-hand approach like I'm doing. See, I'm up here on the column, and I can keep it relatively still with 2 hands. All right, so make a circle right here. There we go. We're starting to get there. Make a circle. All right. Keep going. Good. Good. We got a couple on outliers here. Let's try and bring those over. We're getting closer. We got somebody up on the ceiling there. Let's bring that down. All right, good. We're getting there. We're getting there. Yeah, make it a little smaller. All right, we got some outlier running around here. Let's bring that one up into the circle. There we go. We got a lost sheep over here. Let's try and bring that guy back in. Come on. You're guiding him. You're guiding him. There you go. All right, let's see if we can clean up that circle a bit. There you go. All right, this person really need to get you into the team here. Who's this? There we go. Get you in there. This person down at the bottom. All right. All right, now everybody try and keep your laser dot as still as you can. Bring this guy up. Getting close, getting better. All right, we're getting there. We got some outlier up here. Let's bring you down. Bring you down there, good. Right, again, 2 hands to stabilize. You can keep it right on point. All right, now let's try and not move around as much and see if we can. There we go. If you need to stand up, if you're in the chairs, you can do that. All right, so we're getting into a circle. Let's see if we can do a square. All right, see if we can do a square right here. Do a square right here. Okay, yeah, we got 3 corners there. There we go. All right, so let's try and get our points aligned there in a square. We've got 4 corners here. Yeah. And then everybody should be keeping their dot still. All right, we got a couple outliers, still flying around on the ceiling. All right, we're getting closer, All right, got a couple up here and one guy over here that's... Come on, we can do it. I know we can. All right, if you're using one hand, I think you're going to need to stabilize with the second hand to keep your dot still. Yeah. All right. Maybe we'll go back to circle. Circle may have been easier for folks, I think. Let's go back to a circle here. We were better at circle. Let's do a circle right here. We're going to do a circle right here. That's me circling. Everybody else, their dot should be still. All right, let's see if we can get it one more time. We did it once. Let's do it again. Let's get a circle right here. I'm making a circle. That's me. Everybody else should be still. Just put your laser somewhere and create a circle. There we go. We're getting there, All right, keep your eye focused on your dot so you know where your dot is. And then keep the circle. Here we go. We're getting there. Yeah. Okay, we got a bunch of lasers on the floor here. I don't know why we're not up here, but we want to be in a circle right here. Let's try one more time. There we go. There we go. We're starting to get it. There we go. Put your point in there. Hey. All right. We did it for a few seconds. All right, so we saw a circle a couple of times, right? And you know, if you had tried to do this with a plan that everybody was given directions to, you know, put your pointer at this grid mark and that grid mark, and we never would have gotten there, right? We had, with a couple of minutes practice, a couple of good circles that we were able to come up with, right? And so that shows the idea of empowering distributed systems with just a simple rule, right? A simple rule of take your laser pointer and put it up on the wall and be part of the shape that we're trying to create. And then a vision for what we're trying to achieve, right? Which is a circle. And then allowing everybody to have visibility or situational awareness on what's happening, right? We can see where everybody's pointer is and we can see where our dot is compared to everybody else's. And so that's emergence, and that's the power of communities and distributed systems, and why that approach for pandemic response, health emergency response, is such a powerful way to think about enabling and empowering communities to be part of the solution. Thanks very much.
Thanks, James. I hope we get to keep the lasers. Awesome. Yeah, there you have it, some souvenir. With your permission, Madam CS, allow me to ask you to please go on stage together with your delegation. We have from the ministry, from the World Health Organization, Africa CDC, Madam Chiwule, please, Deputy Governor. Please come on stage. We'll have the first photo. Madam PS, maybe I could just, Madam PS will need you on stage. The WHO team as well. Our various ministers from the different countries represented, please welcome on stage for a group photo. Can have Safaricom please represented as well. Cynthia. I think this will be our final photo. Let me have the representation from the various countries. Chancellor, University of Nebraska, please welcome Dr. Nzai. Come on stage. We'll follow the guidance from, yes. Okay. Do I have representation from the sponsors? Please be on standby. Let me have Robert Koch Institute, RKI from Germany. We have KEMSA. We have the East African Medical Vitals, BioVax, Safaricom, Revital. If there are representations from those companies I mentioned, please come on stage. Representation from sponsors and partners. Please nominate one to come on stage as well. Ladies and gentlemen, please give a round of applause to our CS and the various partners here. This is the grand photo of our summit. Thank you so much, Madam CS, for being here. Thank you so much to everyone as well for participating. We're now transitioning into a breakout for lunch, and after which, ladies and gentlemen, let's be back by 2 p.m. All right, with your permission, Madam PS, there's photo with the Cabinet Secretary as well. All right, let me have representation from the other countries as well. Those representing the various ministers from the other countries, really quick. Okay, thank you. From Comoros, Ethiopia, Rwanda, Tanzania, thank you. And I'm told South Sudan will be joining us as well. Botswana, if you're here as well, thank you very much. All right. One more photo as well with the CS, the Deputy Director, Africa CDC, the World Health Organization. Thank you. Thank you, Camry Director. Let me have CS, just one last one, maybe with the sponsors. Medical Revitals. You still stay. Yeah, with the sponsors, please. Let's have the sponsors. RKI, KEMSA, East African Medical Vitals, BioVax, Safaricom. Sorry, Cynthia, back up on stage. And Madam PS, we need you on that photo as well. All right, Guidance EARGHSS, thank you. Sibusiso, Martin. Let me have the BioVax team. Okay, let's try and make it up. Sponsors and partners. Sponsors and partners, please. Short ones to the front, tall ones to the back. Deputy Governor, Kilifi County, please. Madam Flora Mbetsa-Chibule, please, representing the Jumuiya counties of Pwani. Please welcome on stage. Madam DG, join us, all right. I hope I'm not missing any sponsors and partners. This is our final picture, and after which we'll transition to the press conference. My good friends, ladies and gentlemen, we're coming to you just now. I would ask us now to please take a break. We have lunch vouchers. As you exit the hall, we have lunch vouchers. Please, let's be back by 2 p.m. for the start of the afternoon session. All right, so the ministers as well, and Jumuiya's account is Pwani. Thank you. All right, thank you. Ladies and gentlemen, you can now take a break for lunch. Please, let's be back by 2 p.m. for our afternoon session. The lunch vouchers is just right by the exit. Thank you.
Afternoon. I remember you from last time. How about again?
Salama sana. Good to see you.
Likewise.
Across county to county.
Okay, very good.
Thank you.
Huh?
Thank you very much.
Yeah, I want to. Okay, malizane.
Have a presentation from the various media houses in Kenya.
Thank you so much. So today we are here with the East African community, looking at East African global health security. That is how we can make East Africa safe in matters of health security, and also looking at how we can build our health systems to be more resilient in matters emerging and re-emerging infections, outbreaks, etc. And really what is coming out as key and critical for us in East Africa and Africa in general, even from representatives from more than 7 member states, is that we need to have resilient systems. This includes having universal health coverage that is affordable, accessible, quality care to all, as well as having components of health security strengthened. So today, and in the upcoming days, we'll be having best practices, experience sharing sessions for the various, from the various countries, various ministries of health and their representatives to discuss on how we can strengthen this. So I take note of the question with regards to U.S. government and what was given as an executive order. So as the Ministry of Health, I have tasked the various state departments, the various programs and directors that have been involved or that will be affected by this, so that we can be able to map out and look at the impact in matters finances, in matters human resource, etc. And with this, we will come up with a concrete way forward in terms of interventions, of which we'll be able to share with the Cabinet, His Excellency, the President of the Republic of Kenya, and see how we can move forward in matters intervention. So we kindly request that you give us some time before concretizing this, and we'll be able to share with the rest of the country. Yes. All right. Okay. Sasa kama nchi bado tunaangalia ile mikakati ambayo inaweza kuwa italeta shida kwa sababu ya maneno haya, na sasa sisi tutakuja na interventions, tutaweza kuona tutasonga aje kama nchi kwa kwa maneno ya pesa, kwa maneno ya wafanyikazi, kwa maneno ya ugonjwa, tutaweza kufanya aje ili tuweze kusuluhisha. Sasa hiyo tutaanza tunaongea pia na mkubwa rais wa Kenya, na pia tunaongea na the technical team, na pia tutaweza kuwa na meeting with the African Union. Hiyo ni tarehe 13 ambapo pia tutaweza kuendeleza hiyo maneno. Lakini kama nchi tunakaa kuangalia mikakati ambayo tunaweza kuyaweka wakati huu. Sasa tunawaambia mtupe muda ambapo tutaweza kupa comprehensive way forward kulingana na hayo maneno. Ndiyo, sasa hiyo kwa sababu ya maneno ya there are many donor funded programs in Kenya, US government funded programs, na sasa ndio maana tunataka kuangalia tutaathirikaje, ndiposa tuweze kukuja na njia ya kusuluhisha na tusipatikane kwa athari kama hayo. Yes.
Kindly let us have other speakers give answers. Kindly.
All right, no. Thank you. So, gentlemen of the press, this is Africa CDC, and I would like to tell you that we are quite proud to be part of this summit. And this summit is actually coming at the very right time. And I want to believe that at the end of the summit, this will provide opportunity for us to strengthen our public health institutions, talking of the Kenya National Public Health Institute, talking of institutions like Cambridge, talking of institutions like the MPHI in Rwanda, and all the member states in the East African region. This is also an opportunity to begin to look at the workforce, where we have critical gap. As you are all aware, there is no health without workforce. So hence the need for us to really use this opportunity to revisit that agenda of strengthening the health workforce as far as the East Africa region is concerned. This summit is also going to provide opportunity to revisit the agenda around local manufacturing for health security commodities, talking of vaccines, talking of diagnostics, talking of therapeutics. And one is very impressed with what Kenya is doing under leadership of President William Ruto, who also is a champion for the local manufacturing of health products for the African Union member states. And for the sectors, in Kenya, they're already leading on that. We want to see how this can really spread to other member states within the region. This is also an opportunity for us to really find a way to begin to mobilize resources domestically, because you cannot talk of health security without health financing. So this is critical, and given what is happening at the political space globally, so this is an opportunity to elevate the issue of health financing to the highest political level on the continent. And the African Union, your African Union, is looking at that critically. And come February 14, there is going to be a meeting around health financing as far as our continent is concerned, specifically focusing on mobilizing domestic resources. Last but not the least is around partnership. Partnership that is action-oriented, partnership that is trusted, and partnership that is collaborative and respected. Because we know that there is no single country, no single partner that can do it alone. So this summit is a sharp reminder that we need to coordinate, we need to collaborate, we need to communicate, and we need to cooperate, among ourselves. Thank you.
You said it all. So, ladies and gentlemen from the press, this is WHO. My colleagues have said it all, but just to reiterate that we see this as an opportunity for all countries in the sub-region and, in fact, in the region to come together, reflect on lessons learned, best practices from the past, and discuss perspectives, ways forward, ways of improving the health security in our region. So WHO is very proud to have been a co-convener of this event. And as my brother from Africa, CDC, said, now is time for us to come together, strengthen our partnership, strengthen our ways of working together, and recognize that no country can do this in isolation. And furthermore, he mentioned resource mobilization. We all know the environment we are in, the context we are in, so it's critical to strategically think about ways of mobilizing resources, securing resources, to make sure that our health challenges are addressed. And research and development, also a critical subject for our sub-region. Local manufacturing, as everyone said, and making sure that in terms of supply chain management for pharmaceuticals and vaccines, that policies across countries are harmonized, enabling countries to put their resources together, put their shoulders to the wheel, consider pool procurement for efficiencies, and make sure that our health challenges are properly addressed. Thank you.
Very much. Just to have representation from the private sector as well.
Nebraska.
The academia.
Nebraska.
James to represent Nebraska.
Thank you. Hello, I'm Dr. James Lawler. I'm from the Global Center for Health Security at the University of Nebraska Medical Center in the U.S. And we are very honored to be able to play a part in bringing this group together and to hold this summit for 3 days to discuss the challenges of pandemic and other emerging health threats and how the East Africa region can come together to be a model for the rest of the world in how to create systems that empower the communities and are sustainable and robust and will be effective in preventing and mitigating future pandemics and the disruption that we all get from these challenging emerging infectious disease events and and pandemic threats. Our center is dedicated to global partnerships to combat pandemic and emerging threats. We recognize that this is a collective problem and that none of us is safe until all of us are safe around the globe. And so we welcome the opportunity to learn from you all in the East Africa region and to be able to play a small part in working for future health security within East Africa and across the globe. Thank you very much.
Good afternoon, everyone. I'm Cynthia Kropach from Safaricom Business. I'd like to thank the Ministry of Health, Honorable Cabinet Secretary, and Vision 2030, Emmanuel Nzai, for including us in this inaugural Global Health Security Summit in Mombasa. Safaricom is not a stranger to supporting health as a critical pillar of economic development. As a company, we invest in systems that support digitization of healthcare systems across hospitals across the country, enablement of community health workers, where critical data and early detection and early awareness is important in building a resilient, healthy economy. We have equipped over 110,000 workers with devices that have been manufactured in Kenya. That also represents another critical pillar, local manufacturing, local jobs, and also affordable devices that can be put in the hands of health workers to allow them to provide healthcare universally across the country seamlessly. In addition, these affordable devices are also going into the hands of people so that solutions like telemedicine, where people can get healthcare in the convenience of their homes, becomes important. In this regard, Safaricom is also working on providing, in conjunction with the government, affordable access to connectivity, fiber to the home, public Wi-Fi hotspots that allow universal access for everyone, where no one is denied access. Through our foundations, we have spent billions equipping hospitals, providing access to clean water and education across the country. Every single county has been touched with our Safaricom and M-Pesa foundations. And as part of this global healthcare security is continuing on that quest to partner with government, to partner with other agencies, to provide these solutions everywhere they need to be, especially across this Eastern Bloc. As Safaricom endeavors to be a leading technology company in Africa, it is our purpose to ensure that we're transforming lives wherever they are. We have done so in Kenya and have led the way in that way. We expect to do so across the continent through technology, through investment in systems, and connecting people with health and economic prosperity. Thank you for including us here, Dr. Nzai, Honorable CS, and looking for future partnerships on how we can accelerate the resiliency of health to allow us to be prepared, to have resiliency in our systems, and to provide economic and health benefit for all. Thank you.
County government.
Okay, thank you so very much. I'm Flora Chibule, the Deputy Governor, Kilifi County. We are very much delighted that we host, as Jumuiya za County za Pwani, to have this global summit of security with the invite of the CS, knowing truly well that county governments, we have two levels of government, the county and national government, working together to see how we are going to benefit. And we are looking at partnership, whereby all county governments, including national government, we are going to help in surveillance, helping in screening, so that should there be any other pandemic, how ready are we in infrastructure, in finances and all that. And it's going to be a win-win for the whole counties, Kenya, and the East Africa region. So we thank all of you for the 3 days, and we believe at the end of this summit, we are going to have concrete way forwards, which we are going to be well with us. Thank you so much.
Thank you.